Hey there. Ready to dive into the future of nursing? We're looking at the future of nursing 2020-2030, and wow, this report is full of surprises. It's not just about like bandages and bedside manner. This is about where the whole nursing profession is going.
It's really interesting how the report digs deeper. It recognizes that healthcare isn't just about treating illnesses. It's about understanding the whole picture, the world those illnesses exist in.
Yeah, that's a good point. It really struck me how much the report emphasizes social determinants of health.
SDOH, right?
Exactly. We're talking about the things that honestly sometimes have a bigger impact on someone's health than, any pill or procedure.
It's like they say in the report, health equity is a matter of social justice. And they back it up with some powerful stories, too. Like, did you know the report found that some farm workers are living in converted chicken coops because there's just not enough affordable housing? It's a stark example of how SDOH can directly impact someone's health. You think about it, cramped quarters, often unsanitary conditions, exposure to the elements. It's like a recipe for respiratory problems, infections, not to mention the stress. And what does that do to your mental health?
It really highlights how a one-size-fits-all approach just doesn't work.
Yeah.
So, where do nurses fit into all of this?
That's what's exciting. This report shows how nurses are becoming so vital in addressing SDOH. They're going beyond traditional roles to consider the whole person, connecting the dots between someone's life and their health outcomes.
Okay, so give us some examples. How are nurses actually making a difference in these areas? What does that look like on the ground?
We're seeing nurses connect patients with resources, like a nurse helping a patient find healthy food options through, say, community programs, or even something as simple as helping them get to doctor's appointments because reliable transportation is a barrier.
So they're like healthcare navigators, guiding patients through this complex system. And speaking of unsung heroes, the report shines a spotlight on school nurses.
Absolutely. They're often the only healthcare professional that children, especially those in poverty, have regular access to. They're on the front lines, catching health concerns early on.
One of the things that really stood out to me was how often school nurses end up being like de facto mental health
Same here.
professionals, just because there's no one else. The report makes it clear we need to support school nurses more.
No doubt. It's a huge responsibility. They need more resources, more support, and frankly, more recognition for the role they play in shaping the health of future generations.
Now, we can't talk about the future of nursing without talking about technology. Telehealth, especially, seems like a game changer, particularly for rural areas.
Right. Imagine a nurse practitioner in a remote area being able to connect with specialists who are miles away. It creates so many more possibilities.
It's like bridging the healthcare gap with technology. But, and the report acknowledges this, the digital divide is a real concern.
Exactly. Not everyone can get online easily or even knows how to use technology to its full potential. Ensuring equitable access to telehealth means addressing those disparities.
And of course, all of this innovative care, these expanded roles for nurses, it all needs a system that supports it. What's the report say about the financial side of things?
Well, there's a whole section on new and different payment models that actually encourage addressing SDOH. It's not just about how many patients a provider sees, but about actually improving the health of the entire community.
So it's about rewarding quality of care over quantity.
Precisely. We're talking about models like accountable care organizations, or ACOs, which are about moving away from a fee-for-service model and towards one that rewards value and better outcomes.
It sounds like we're moving towards a more, well, holistic and honestly more effective approach. But let's be real, none of this works without a diverse and well-supported nursing workforce. And the report doesn't shy away from the challenges there either.
You're right. The report argues that a diverse nursing workforce, one that reflects the communities it serves, isn't just a nice idea, it's essential.
And yet we know that the nursing profession still struggles with representation and retention.
Absolutely. It's not just about getting more diverse people into nursing. It's about creating a work environment where everyone feels valued and respected and can actually thrive.
And we can't finish this part of our deep dive without acknowledging the elephant in the room, right?
Yeah.
Burnout. It's something that's impacting nurses everywhere.
You said it. The report really tackles nurse burnout head on. It acknowledges the pressure nurses are under, caring for patients and dealing with their own stress.
It's like they say, you can't pour from an empty cup.
Exactly. And the report is very clear. A burnt-out nurse can't provide the best care. It emphasizes the need for real solutions, addressing things like understaffing, lack of support, and a culture that often prioritizes patient needs above all else.
It's a two-way street, isn't it? A healthy nurse means a healthier community. But before we get too far ahead of ourselves, There's one more crucial aspect highlighted in the report: leadership.
Yes. We're seeing nurses stepping up into leadership roles more and more. They're advocating for policy changes, spearheading community health initiatives, really driving innovation.
These are the nurses who are shaping the future, not just adapting to it. They're inspiring the next generation. We've covered a lot of ground, from social determinants of health to telehealth, the need for diversity in nursing, and the critical issue of burnout. This report is full of insights.
And we've only just scratched the surface. What's important is that these aren't just separate issues. They're all connected to this larger idea of health equity.
And that's where you, our listeners, come in. This isn't just about absorbing information, it's about applying it. So before we continue and unpack even more, take a moment to think about what stood out to you. What challenges or opportunities resonate most with your own experiences?
We've given you a glimpse into the future of nursing, but the question is, how will you be a part of shaping it? Whether you're a healthcare professional, a student, or just someone who wants a healthier community, there's a role for you to play. So before we dive into even more of the Future of Nursing report, we asked you to think about how these trends connect to what you see every day. It's about making this real for you, you know?
Exactly. And since we're talking about making it real, I want to circle back to something you mentioned: nurses taking a more active role in addressing social determinants of health. All those factors that impact a person's well-being, but aren't always directly related to medical care. The report highlights some interesting programs, real-world examples of nurses taking the lead.
Definitely. One that comes to mind is the Camden Core model. They're using data in real time to find those frequent flyers in the ER people who are often dealing with really complex health and social needs.
So they're not waiting for people to end up back in crisis mode.
Exactly. They have this team, nurses, social workers, community health workers. They reach out before things escalate. They offer support, connect people to resources like housing assistance, food banks, mental health services, basically creating a safety net.
It makes you wonder why we don't see this proactive approach more often.
Well, one thing the report emphasizes is that good intentions aren't enough. We need a real shift in how we think about healthcare. The Camden Core model is a good example of how we can incorporate a trauma-informed approach.
Now you're speaking my language. It's not about putting on a Band-Aid and hoping for the best. This report really gets into how someone's past, things like trauma or systemic disadvantage, can impact their health in ways we might not always see.
You're right. And the report highlights some impressive results from programs like the Camden Core model. We're talking real reductions in hospital readmissions and even overall healthcare costs. So it's not just the right thing to do for patients, it makes sense financially too.
Right. Invest in prevention now or pay the price later. But let's be real here. Addressing those deep-rooted systemic problems, getting to the why behind health disparities, it's a massive undertaking. What's the report's take on tackling something that complex?
They advocate for a multi-pronged approach. It's not about finding one magic solution, but multiple solutions working together. We're talking policy changes, more funding for social services, and, this is key, empowering communities to take charge of their own health.
Giving people the tools to advocate for themselves, not just expecting them to navigate these complicated systems alone.
That's it. We need to advocate for affordable housing policies, ensure everyone has access to quality education, and address things like environmental injustice. All of these directly impact health. And guess who the report identifies as critical in pushing for these changes?
Nurses, right. They're the ones seeing the impact of these social inequities firsthand every single day.
Exactly. Nurses are in a unique position to raise awareness, advocate for change, be real champions for health equity. And it's not just about speaking up. The report talks about how different payment models can actually incentivize addressing SDOH.
We touched on this earlier, but give us the details. How can a payment model actually make a difference?
Okay, so think about the traditional fee-for-service model. It often rewards providers for how much care they provide, not necessarily how good that care is. So what if we had a system that flipped that, where providers were actually rewarded for keeping people healthy and out of the hospital?
So we're shifting the focus from treating illness to preventing it.
Exactly. The report points to examples like those accountable care organizations, or ACOs. Providers in an ACO can actually get bonuses for meeting certain quality benchmarks, including those that are all about addressing SDOH.
So it's like we're finally connecting the dots, aligning what we know is good for people with how we actually fund healthcare. But even if we have all the right systems in place, we need a workforce that's prepared. And I don't just mean clinically.
You're right. We can't forget about the nurses themselves. If we want a future where nurses are leading the charge on health equity, we need a workforce that's not only diverse, but supported and empowered.
And that's where things get even more complicated, right? The report acknowledges that nurse burnout is a major problem. We can't just expect nurses to fix these complex social problems if they're burning out themselves.
It's not sustainable. The report is really clear about this. Addressing burnout means looking at the system, creating supportive work environments, dealing with things like inadequate staffing, building a culture that values the well-being of nurses.
A healthy nurse equals a healthier community.
Right.
And, this is important, we need a more diverse nursing workforce, one that reflects the diversity of the communities it serves.
You got it. Diversity isn't about checking boxes. It's about providing culturally competent care, understanding the unique needs of your patients.
And the report has some concrete recommendations on how to do this, right?
It goes beyond just recruitment. We're talking about building an inclusive environment where nurses from all backgrounds don't just survive, they thrive. Representation matters, especially in nursing.
Okay, we've covered a lot of ground, but I want to touch on one more thing before we move on.
Technology.
You mean telehealth? This report highlights how much potential it has to change how care is delivered, especially for rural communities or those with limited access to traditional healthcare.
It's like bridging the healthcare gap, but with broadband. But, and this is a big but, we have to adjust the digital divide. Otherwise, we're just going to widen those disparities.
Absolutely. The report is very clear about that. Equitable access to technology isn't optional. We need to make sure everyone has reliable internet, devices, and even the skills to use them.
It's not enough to just have the technology. It has to be accessible and usable for everyone.
100%.
Mm.
And it goes beyond telehealth. The report also gets into the importance of data.
Data might sound a little dry, but I have a feeling you're going to make it interesting. What's the connection between data and health equity? It's all about using data to actually see the disparities, track progress, see if our interventions are actually working. Are we moving the needle on health equity? Data can help us figure that out.
So we're using data to understand the problem and track our progress toward solutions.
Exactly. For example, the report suggests creating a national database to track social determinants of health. That would give us a real-time picture of health disparities across the country. Then we can target our resources more effectively.
It's like having a map to show us where the needs are greatest.
Right. But just having the data isn't enough. The report also talks about the importance of getting communities involved in this process.
Because, at the end of the day, it's about empowering communities to take control of their own health, right? We can't just swoop in with solutions. We need to work together.
I completely agree. We need to listen to those most affected by these disparities and work with them to develop solutions that address their actual needs.
Okay, let's take a breath for a second. This report is packed with information. We've gone from specific programs and payment models to the importance of data and community involvement.
It's a lot to process, but I think the main takeaway here, the thing that ties all of this together, is that the future of nursing is inseparable from the pursuit of health equity.
Absolutely. We can't talk about one without the other. But before we move on to the last part of our deep dive, where we'll explore the specific action steps in the report, let's pause for a moment.
This isn't just about passively taking in information. This is about you. Think about how these trends affect your own community, your workplace, even your own experiences with healthcare.
All right, so we're back and ready to jump into the solutions part of this Future of Nursing report. We've talked about the big issues, things like social determinants of health and burnout. But I appreciate that this report doesn't just leave us hanging, with a bunch of problems and no answers. It actually offers solutions.
Totally. It's like a roadmap with concrete steps we can take. And it all connects back to what we've been talking about. Remember all those aha moments? They're pointing us toward a better future for nurses and for everyone.
So we've laid out all the puzzle pieces, and now we're finally seeing the whole picture.
Exactly. And one of the big recommendations is expanding how advanced practice registered nurses can practice. They're called APRNs for short. It's about letting them really use all of their education and training.
That makes sense, especially with how important it is for nurses to take a more holistic approach. We keep coming back to that.
Right. And right now, there are all these restrictions on APRNs, preventing them from doing just that. This report argues that getting rid of those roadblocks could be a game changer. Think about it. It could drastically improve access to care, especially in areas that desperately need more providers.
We're talking about places with doctor shortages, right? It's like we have this amazing resource, all these highly trained nurses ready to help, but the system itself is holding them back.
It's true. The report even mentions a study that found that expanding APRN practice could give millions more people access to primary care and save billions in healthcare costs. So we're not just talking about better care, we're talking about a more efficient system overall.
Okay, that's a win-win for sure. And speaking of investing in the future, the report talks about really increasing funding for nursing education.
100%. And not just any nursing education, we're talking about programs that emphasize, the stuff that really matters. Social determinants of health, health equity, leadership skills, all the tools that the nurses of tomorrow are going to need.
It's not enough to just teach nurses how to work within the current system. We have to prepare them to change it.
Now you're talking. And it's not just about that initial training either. The report really stresses the importance of continuing education throughout a nurse's whole career. Healthcare changes so fast, nurses need to be able to adapt and lead the way.
So it's about lifelong learning, always growing and improving.
Imagine this, nurses. With all their knowledge about what patients need, their expertise in delivering care, their passion for health equity. Now imagine them at the table where policies are made.
Okay, I'm getting chills. Because nurses are already advocating for change, this report says we need to take it further. It says we need more nurses in leadership roles in all areas, hospitals, clinics, government, nonprofits, everywhere.
That's how we create real, lasting change. When nurses have a voice in those spaces, when their perspectives are valued, it can transform healthcare policy.
And we can't forget about the nurses themselves. We keep coming back to burnout, the stress of the job. This report doesn't sugarcoat that.
It actually calls for a huge change in how we support nurses. It's not just about saying thank you. We need action. Addressing workplace violence, building a culture of respect, making work schedules more flexible, real concrete changes.
It's about recognizing that when nurses are taken care of, when they're supported, it benefits everyone. Burned out, overworked nurses can't possibly give the kind of high-quality, equitable care that we all deserve.
Couldn't have said it better myself. And here's something else to think about. Something I'm sure you, as a dedicated listener, have considered. What happens when disaster strikes? Think about it, natural disasters, pandemics, public health crises. These things put a huge strain on the healthcare system, and nurses are always on the front lines.
That's right, we see it over and over. Nurses stepping up, risking their own well-being to help others. This report says we need to make sure they're prepared for these kinds of events. They're only becoming more common, right?
Exactly. We need to strengthen nursing education, make sure it includes disaster preparedness and response training. Nurses need the knowledge and the support to handle whatever comes their way.
We need a more resilient healthcare system overall, one where nurses aren't expected to just be heroes, but are empowered to lead with the knowledge and the resources they need to protect themselves and the people they care for.
So as we wrap up this deep dive into the future of nursing, remember that this report isn't just a document, it's a call to action.
A call to action for everyone. Nurses, policymakers, students, really anyone who cares about healthcare.
Ask yourself, what really made you stop and think during this conversation? What sparked something inside of you, a desire to be part of the solution?
What can you do right now to contribute to a better, more equitable future, even if it feels small?
Maybe it's contacting your elected officials, volunteering, donating to a scholarship fund. Maybe it's starting a conversation with your own healthcare providers about these issues.
The future of nursing isn't some abstract idea. It's happening right now. And all of us have a role to play in shaping it.
Thanks for joining us on this incredible journey. Remember, knowledge is power, but action leads to change.